My name is Dan Boffa. I'm a thoracic surgeon at Yale University in New Haven. I am currently an associate editor for feature articles, and I've been doing that since August of 2015. I would say that if somebody is just starting the process of writing papers to be published, prepare for rejection. I've written several papers, and I have been rejected quite frequently, and I think resilience is important. I think that taking comments that are that maybe you don't want to hear, taking them to heart and trying to respond in a way that you're left with a better manuscript, but to not take things personally, but to just to keep going, be tenacious, and if it's a story worth telling, eventually you'll be able to tell it. The most common reason that the manuscripts are not selected for publication, in my experience, is that they don't represent something that's novel or something that would allow the readership to better take care of patients. In some ways, I feel like I'm Alex Trebek on Jeopardy, where I come across a lot of things where actually I don't know the answers. I look them. I'm not familiar with the topics. I will search them through PubMed, and if I see that there's been an extensive body of literature on the topic, then it's generally something we don't select to publish. Or if it's something that is so esoteric that, while interesting, not interesting to the readership of annals, then that's something that we would likely not accept. In general thoracic surgery, I see clinical trends being the approach to patients with less and less invasive treatment modalities. I suspect over the coming decade that will become more and more endobronchially based as tumors are diagnosed at progressively earlier stages. Hopefully there is a greater use of more effective targeted chemotherapies, such that the pool of people we currently consider to be too advanced to approach with curative treatment, that we convert at least some of those patients into a state of their disease that could be approached with curative intent therapies. The most rewarding part of my practice is the ability to connect with patients as people at their most vulnerable point in time. When people present with a problem, like many surgeons, I and my partners practice in an area where a lot of patients have been told they have a very difficult problem and may have been turned down for aggressive treatment and for various reasons, and to be able to ask them to trust you and to confidently assure them that you can get them through the process and then deliver is incredibly rewarding. And I think that that is a testament to the whole process of becoming a thoracic surgeon. I think that if you commit to the training and you commit to staying up to date, then you will be effective and you will be able to deliver and take care of patients with difficult problems. I have a lot of sayings that I've developed over time, and one thing that a concept I've more recently come up with is that that greatness is not achieved through great achievements, but through contributions. And what I mean by that is that, greatness is not getting an award or getting a position, but what you actually are able to contribute to your field. And thus far, I really don't feel like I've made a significant contribution, and that's something that, as I sort of map out the next chapter of my career, that I'm investing the effort in doing, either from a outcomes research standpoint, or having been a carpenter before I started all this, I would like to come up with some technical contribution that changes the field and makes our practice better.